everybody hear me? Ah, it is working. We were having a problem with the printer. So instead of waiting on the programs, we're going to proceed without the program. So I apologize. The program doesn't have their names on it. It just had the order of business so that you guys would know. So I think we'll be okay without it. But I am Dr. Lori Conyers, the Family Nurse Practitioner Program Director, and Dr. Karen Higgins, faculty, is here. And we just asked everyone, just to make this a special moment, would you mind please rise if you are able, and we're going to have our FNP students join us here in this front row. All right, everyone, thank you. Please take a seat. So the white coat in medicine and in nursing has always had a special place. And we have spent the last 2 days really putting them through it just a little bit. In good ways. But the purpose of this is to not only help us validate that what we're teaching them is sticking and they got it, but it's also to help them validate their own perspective, because they're getting ready to head out into the clinical rotations, which is always an intense part of the experience. It's been a true privilege for me to be part of this whole journey at Murphy Deming College of Health Sciences to kind of expand on the proud tradition of Mary Baldwin, where we really want to make clinical excellence meet compassion and caring. And we want to also produce leadership for the future healthcare workers, and that's what we want all of our students to be. Today's white coat ceremony is a symbolic gesture. This is our way, as their faculty, of letting them know we trust them. We've seen them in action. We've seen them see our standardized patients. We've seen them do procedures. And we are now have given them our stamp of approval. And we're going to put that white coat on them proudly and send them out into that clinical world to represent not only the school, but represent us in our communities. For generations, the white coat has signified clinical knowledge, professionalism, and trust. All Murphy Deming College disciplines participate in some type of white coat ceremony, whether it's physical therapy, occupational therapy. They all have a white coat ceremony because it carries something deeper. It's a commitment to our interprofessional collaboration as healthcare professionals. It also means that you need to be lifelong learners. As you advance your nursing education, it never stops. I think we've said that a lot in the last 2 days, that you never stop learning. You're not just joining a profession, you're really joining a whole culture of how you care for each other and your patients and people around you. At Murphy Deming, you've been challenged not only to master the complexities of pathophysiology and pharmacology, your favorite classes, right? Okay, I got a little bit of a yes there. But you also have been able to develop empathy, cultural humility, and also some ethical grounding to help you kind of go out into that clinical world where you can make good decisions. That is the foundation of the white coat. It's what sets you apart as a family nurse practitioner and as a school of Murphy Deming. That's what we want you to represent. As you slip on that white coat today, take a moment and reflect. Reflect on your nursing journey that brought you here. Reflect on the people who brought you to this moment in time that helped you get this far, and the mentors that have guided you, your peers, and your family. Remember that coat is not a symbol of authority. It's a symbol of service, and not of just prestige, but of purpose. There will be days ahead that you are challenged. There'll be days you leave your clinical rotations that you're like, why did I choose to do this? But on those days, you just have to put your self-doubt on the back burner and get back to the basics of what made you do this to start with. So wear that white coat with pride, with humility, and let it remind you of your mission to heal, to advocate, and to lead, but above all, to care, and remember that you're a nurse first. Thank you, and congratulations. She was behind me. All right, and I'd like to introduce you to Bev Caldwell. She is teaching the course that is associated with this event. I was going to say today, but today and yesterday. And she will be helping present the white coats. And Dr. Higgins is going to read their bios.
Okay, I'll be reading each name and a little bit about each student. And we are so proud of all they've accomplished and all that is ahead for them. I'd like to start with Hope Gonzalez. Hope's nursing career has been rooted in service, growth, and a genuine love for helping others. From her beginnings as an LPN to earning her master's in nursing education, she has embraced every step with curiosity and purpose. Her work as a maternal newborn nurse and clinical instructor has allowed her to support patients during life-changing moments while guiding nursing students as they discover their own strengths. Hope believes deeply in accessible, compassionate care and in the power of education to transform communities. Entering nurse practitioner school represents her next step towards expanding her impact, providing holistic, evidence-based care and advocating for patients across the lifespan. She is honored to continue her journey in advanced practice and grateful for the opportunity to serve. Hope Gonzalez. Catherine Kamara. Catherine graduated from Radford University, Carilion, formerly Jefferson College of Health Sciences, in 2020. Since becoming a registered nurse, she has cared for patients in a variety of settings, from home hospice care to cardiac and respiratory progressive care and labor and delivery, where she had the privilege of helping welcome 389 baby girls and 156 baby boys into the world. Outside of nursing, Catherine is a proud aunt to 6 nieces and nephews, loves any excuse for an adventure, and is an avid reader who will happily stay up all night with a good book. She credits all her success to her incredible family, especially her sisters, who have always challenged her to be the best version of herself, and her parents, whose unwavering love and encouragement have made every dream feel possible. In fact, her parents spent years telling her she should become a nurse practitioner, but it wasn't until a palm reader in New Orleans told her to go back to school that she finally listened. Today, as she celebrates her white coat ceremony and reaches the halfway point of her journey to becoming a family nurse practitioner, Catherine is honored to take this next step and looks forward to continuing to care for her patients and families with compassion, curiosity, and dedication. Catherine Kamara. Carlissa LaBeouf. Carlissa is a board-certified psychiatric mental health nurse practitioner currently working at Freedom Recovery Center in addiction management and substance use recovery. Carlissa has been in the field of mental health for over 8 years. She started her professional career when she was a case manager for individuals with substance use and mental health conditions, where she met a nurse practitioner and fell in love with the treatment she provided for the patients. She decided to obtain her certified nursing assistant license to make sure she was a good fit for the medical field. She obtained her associate degree from Medical Career Institute of ECPI in February 2022. Then she obtained her BSN from Radford University online in December 2022. She obtained her MSN in her master's degree in May of 2025 and achieved board certification in August of 2025. She has recently opened her own private practice called Phoenix Holistic Health and Wellness, LLC, where she will see patients of all ages virtually for medication management and therapy. She is looking forward to becoming a family nurse practitioner so she can provide more holistic care to the patients she serves. Her professional goal is to offer urgent care, physical and primary psychiatric care, and options for functional medication and serving throughout Richmond, Virginia, and the surrounding areas. Personally, Carlissa is a landlord and leasing agent as the owner of LaBeouf Leasing, LLC. She is also the mother to her energetic 6-year-old Genevia Maureen. As Carlissa's pride and joy, she keeps her busy and on the go with her chartered school and competition dance engagements. She is also a proud member of Alpha Kappa Alpha Sorority Incorporated, which she has just celebrated with them for 4 years. Carlissa LaBeouf. Carissa Martin. She has been a registered nurse since 2012 with a background in med-surg, pre-op, IMPACT-U, the operating room, and aesthetic nursing. She loves combining her clinical expertise with a passion for helping patients feel comfortable in their own and confident in their own skin. When she's not caring for patients or doing schoolwork, you'll find her spending time with her husband, her 2 boys, and their dog. Carissa Martin. Crystal McCoy. A profound personal loss in her early life inspired her to pursue nursing and dedicate her career to caring for others during some of their most vulnerable moments. Becoming a family nurse practitioner has been her dream since she began nursing school. And with the encouragement of the nurse practitioners she worked alongside, she finally took the leap to make it a reality. She is deeply grateful to her husband and her 4 children, her sisters, and her entire family for the love, encouragement, and sacrifices that carried her through this journey. She is excited to begin this new chapter caring for patients as a family nurse practitioner in hereditary breast and ovarian cancer. Outside of work, she enjoys riding her motorcycle and playing the piano. Crystal McCoy. Cipriana Pena. She has been a nurse for 32 years. She started as a certified nursing assistant, then became an LPN, an associate degree RN, then she has her bachelor's and her master's degree. And finally, she is in a nurse practitioner program. It's been a really hard journey, and she will continue on until she attains her goal that she set out to achieve. She started in a small town in a rural area of Texas and traveled her way across the country before the huge COVID contact tracks. This is a huge accomplishment for her and her family. She wishes her parents could attend, but one is in heaven and the other is praying relentlessly for her at home. She has 5 beautiful children and 3 wonderful grandchildren, and let's not forget Wawa, the miniature Dachshund that she has, and Yara, the grand dog. Cipriana Pena. Pulumi Kuden is a registered nurse and a family nurse practitioner student dedicated to providing compassion, evidence-based, and patient-centered care. She has developed a diverse clinical experience caring for patients with complex medical needs in acute care settings and fostering a strong foundation in clinical assessment, patient advocacy, and interdisciplinary collaboration. Driven by a passion for improving health outcomes, Pulumi is committed to promoting wellness, preventing disease, and delivering high-quality primary care across the lifespan. Her professional interests include preventive medicine, chronic disease management, and caring for older adults. As she continues her FNP education, Pulumi looks forward to serving individuals, families, and communities with excellence and lifelong learning. This is Pulumi. Arwen Wagler. Arwen has been a registered nurse since 2018. Her family are her favorite people and her biggest support, and she wouldn't be furthering her education without their love and encouragement. Arwen's professional experience includes working with folks living with HIV and AIDS, critical care nursing, and public health nursing with significant experience working with underserved populations. She served as the practice manager and clinical director for federally qualified health centers in Harrisonburg and Lexington, and currently serves as the Director of Nursing Services at UVA's Student Health and Wellness. Arwen Wagler. And we would also like to recognize 2 students who weren't able to join us today, and that's Abby Cantrell and Madeline Quisenberry. And these are our new FNP students.
Don't they look good? Yeah, I think they look really good. So we're going to keep this very short and sweet. I just want to congratulate each one of them as well as their family support, because I know all too well how much support it takes to get through grad school. On that note, you can have them back in a few moments, but not yet. If you would, students, we're going to all give you a big round of applause, but after that's over, would you step right outside the doors so that Rachel can get a group picture of you? And then you guys can disperse and get some family pictures. There's some really great spots right outside this door for some really good pictures. There is also light refreshments at the back. On that note, can I get everyone to please give them a really big round of applause and congratulations?